Hello everyone. This is my first lecture, my first live in the YouTube channel. This is Muhammad Sadikli. I'm orthodontist. I will share with you this case today. It's class 3 with open bite. But now first I will share this link on my Instagram so we can have more attendees. I'm live now on Instagram. I will share the link. I'm live now. I am live now. Swipe up as usual. And let's go for the presentation. Okay, we are waiting some attendees. You are welcome, everybody. So let's start together. And for sure, this video will be recorded and posted on my YouTube channel also. And let's start. Okay, the case is adult, class 3, and open bite case. And the special with this one that I used Damon Clear 2 system for this case. Let's go for the before treatment photo. Let's see together here. It's open bite, as I told you, open bite, 40 years old female. Okay, but really she has a good oral hygiene. Everything is fine, the bone is good, so whatever the age is, the teeth are good, so we can do full treatment for her. See here, for the right side, we have class 3 with the canines and the molars, and here, left side is a class 1 relation, and see here the open bite, it's around 2 to 3 millimeters, and here we have moderate crowding, and here mild crowding. OPG X-ray actually is fine. She has only one impacted third molar here. Here partially impacted or blocked. She has partial erupted third molar. And we can here only notice the asymmetric in her TMGs due to her case and the cross bite that we saw on the right side and the narrowing and some open bite. So sure we will have some issue with her TMGs. Here, lateral ceph. In this case, actually, I will share this case with you, not as a classic case presentation with all the cephalometric analysis and like this. Actually, in this case, I want just to share with you how I find that this one, the treatment keys for the cases that I usually treat in this way. This case was having some treatment keys that I found when I did good diagnosis for the case, so I treated in short time and in really easy way. See here, the skeletal numbers are good. She is almost class 1. There is a tendency to class 3. The chin little bit protrude, but the patient has good volumes with her checks. She has like good face. So the skeletal number actually for this case, it's not that big problem to stop with it because the patient has good profile. In this age, 40 years old, and if we have a chance that to have treatment plan without big surgery or maxillofacial surgery, let's search for a solution that in short time and without surgery. So here we don't have any reason to have surgery or aesthetic surgery for this case. So let's move for that dental numbers, here we see that all the biprotrusion numbers will be shown here. See the upper incisor. See this is Steiner actually. This number is for Steiner analysis. So here we have 43 degree for the upper incisor and 43 here also for the lower incisors, and interincisal angle is 131 as a normal, but here we have 93, and see we have also these two numbers are increased. So we have clear biprotrusion case. Okay, but the patient has good closure for her lips, so the biprotrusion is not affected on her profile. Okay, so the treatment case until now is the almost class 1 skeletal, so we don't have skeletal problems, and we have biprotrusion, okay, on her anterior teeth. Another treatment key. Here, this is the midline of the face midline, the red line, and we have here the upper is midline shifted to the right, and the lower is midline shifted to the left. This midline shift is really good treatment key, because if I want to use class 3 elastics from this side, I will fix the class 3 in same times the midline shift will be fixed. So this another treatment key. And also here, as I show here, there's almost crossbite on this second premolar. So there is a narrowing on upper, and the crossbite, usually the bad or the crossbite or bad occlusion on the posterior teeth will be as a result with the open bite. So if I fix the narrowing and this crossbite in this side, I will have improvement for this open bite. And actually, there's also bad fillings or maybe large fillings for the distance between this teeth and this teeth. So, and also here you can see the shape of the lower incisors. So I can have some IPR also to have some spaces to solve this crowding and this crowding. So I have now many keys for my treatment planning. And see here, as we see here, that crossbite, class 3, okay? And as I told you, the class 3 is only on the right side. There is midline shift with the class 3 that I have here. So the treatment plan include upper expansion. So it's include expansion, okay? This first thing in my treatment plan. With the expansion, I need to have class 3 elastics from the beginning of the treatment, or at least from second month of the treatment, to start fixing the class 3 here, and in same time to fix the midline shift in this case. So if I want to do expansion and using early intermaxillary elastics, okay, and I need full control for the teeth, which kind of brackets I have to use? Self-ligating brackets, and for this case with the intermaxillary elastics. For the case that it really need to have intermaxillary elastic with it, I need to have self-ligating system or passive self-ligating system, which is the Damon. So I used light forces from second month of the treatment with Damon system. After that, I put Damon system, Damon clear 2 on upper and lower with the light forces of class 3 from this side and triangle elastic from this side, just to support this elastic and to support the patient lower position, mandible position. And then for sure I did IPR in this area for upper to solve the problem of the protrusion, to have some spaces to solve the problem with the crowding, and the protrusion was solved with the expansion that it's come with the Damon system. okay, as a benefit. And here I did IPR for all of this area. Actually, here I did like 0.3, and here 0.3, here up to 0.5 for two things. First, to have spaces and to reshape the incisor that we saw them on the first picture. Let's go back for the incisor, see the triangle shape. So I can take this point for me to have spaces and reshape the incisors. And as we all know that we can make up to 0.4 to 0.5 millimeter IPR from every two teeth. So the one teeth will have around 0.2 millimeter of IPR. And now, after 8 months of this treatment, I got this result. Actually, these photos was taken before I use vertical elastics from each side, from two sides. So with these photos, I was using only class 3 from here, okay, and triangle from here. The class 3 was from uh, upper 7 or second molar until two teeth here. So I will have some of vertical forces, and here actually I have vertical forces. So you can see here how the anterior open bite was closed, and the midline shift almost fixed in first 8 months. And you can notice here I still here with the copper night tie wire. The sequence that I use with the Damon system usually, and the sequence that I used with this case, I started with 14 copper night tie. With 14 copper night tie, I didn't use intermaxillary elastics. And then I go to 18 copper night tie, which I started the intermaxillary elastics with. I used 5 on 16 light elastic for 8 hours. Then I increased it to 16 hours when I got the 1425 copper night tie on upper and lower. And then I keep using the 516 until I reached 1825 copper night tie for upper and lower, and then I started to use 1 on 4 heavy elastic with class 3 elastic for the right side and triangle for the left side until I reach this stage. After that, I switch this wire to the 1625 stainless steel diamond shape. Okay, here I use also the upper one is 19. Here in this stage I reach 1925 stainless steel diamond arch wire, the diamond shape, and here 1625 stainless steel diamond shape. In this stage, after that stage, I started to use vertical elastic and class 3 elastic in same time. Like you can use class 3 1 on 4 as example from the right side, and in same time you can use also 3 on 16 as a triangle to fix the bite in this area. Okay, this thing that I used for 1 month only, but mostly I use class 3 with the two teeth here, so I fixed the class 3 as you see here. Here after 8 months I almost have class 1 here, and for sure see the occlusion how it's perfect in this area after only 8 months. And after 12 months I reached this result after 12 months of the bonding stage, okay, of the bonding. So the case takes exactly 1 year to finish with really cooperative patient. She was using the elastic very well, exactly as I told her, that 8 hour or 16 hour or 12 hour. When I reached stainless steel wires, she was using the elastic for 12 hours. Let's go back a little bit for this photo. See, there's problem here in the axis of this incisor, and there's little problem here in the axis of the lateral. I did some wire bending to reach this result, and also sure in the last few months of the treatment, I did some occlusal also modification to have this good relation between the upper and lower teeth. See here, the midline shift is almost done, and see there is a good, very nice occlusion and very nice alignment for the teeth. And see here, the shape of the teeth little bit changed. I changed the I modified the fillings here. I did some IPR, so we have good contacting between the teeth and good relation between the upper and lower. And see that the arch form is U now. I have some expansion in this area that gave me some space to solve the protrusion and solve the crowding. And now you can see exactly what happened. See, the lower teeth actually was not that protrude, but the IPR here solved the crowding, okay? But here that there was really good fixing for the upper teeth. See, the axis. Now I have good result. Actually, I choose to have some extrusion for, or maybe taking the upper incisor down because of the smile line of the patient. So the smile line of the patient who decides which teeth must be moved down or up. If the smile line was good for the patient from the beginning of the treatment, I should move the lower teeth. But for the patient, the smile line wasn't good when I started. When she was smiling, the upper teeth doesn't that like proper showing when she smiles. So I really needed to have little bit extrusion for the upper teeth to have good smile line. And this reason why I choose to have extrusion on the anterior teeth, not to do intrusion for the posterior teeth, because I really needed that to make it so I can make good smile for the patient. See the progress? I think it's nice. And here we'll see before and after how the midline fixed, how the shape of the lower teeth and also upper teeth and lateral little bit modified it. Class 1, good occlusion. I fix here the crossbite. Now the premolar is good with the lower. Left side, it was almost 90-degree rotated canine. Everything is fine. When you fix the rotation, when you fix the crowding, you have good occlusion with the upper, and you can reach this kind of occlusion. And here the left side, class 1 canine and the class 1 molar, good occlusion. There is no open bite. There is a proper overbite and proper overjet. And here you can notice how this area little bit expanded. The teeth were really aligned. For sure, I need to use every retainer that I can for this case, and for sure I'm going to watch up the case and do follow up every 2 to 3 months to be sure that everything is fixed and the tongue is on that place. For sure, for this case I use retainer, whole retainer with hole here, so the patient will know where to put her tongue. When she speak, when she relax, she has to put her tongue in this area. So I made a hole here in the Howley retainer, so the patient as a tongue guidance, so the patient can put her tongue in the proper place. For the lower, see the crowding solved without having procline teeth, because I did some expansion with the Damon system and fixed the rotation or the rotation. And so, as I told you, first the expansion and fixing the rotation and also the IPR. So, and with the class 3, I have some distalization for this area. So I have space, good space to have alignment for these teeth without having proclination. This is my notes for today. This is my tips. I hope that you enjoyed this case, and for sure there's a lot of cases coming soon on my YouTube channel. So see you soon, my friends, and I hope you enjoy everything I give you. And if you have any question, you can just post it in the comment under this video. This video will be recorded and I will post it on my YouTube channel, and you can reach it anytime you want. And see you soon. Goodbye.